April 2000, Dr. Baum was appointed Medical Director of the John W. Henry Center for Integrative Medicine, the Mind Body Medical Institute at Boca Raton Community Hospital. A national lecturer, Dr. Baum is devoted to educating medical and orthopedic doctors, as well as the lay public, about alternative approaches to treating cardiovascular disease. Dr. Baum has lectured for organizations such as the American Association of Retired Persons, the American College for the Advancement of Medicine, and the National Nutritional Foods Association. Dr. Baum has also been interviewed on television shows such as MSNBC, CBN 700 Club, and The Voice of America. Dr. Baum sits on a board of advisors to Baxter University in Seattle, Washington, and is an adjunct professor at FAU. His book, The Total Guide to a Healthy Heart, was released by Kensington Press on September 1, 1999. You can get his book, The Total Guide to a Healthy Heart, at different bookstores around Boca area, like the Liberty at Barnes & Noble. You can also get it at Amazon.com. Ladies and gentlemen, let's welcome Dr. Seth Baum.
Sorry about that. That was very, very long, and I apologize for that. Anyway, thank you very much for having me here tonight. Thank you, Rika. That was very kind. And we're going to talk about tonight beyond menopause, living life wholeheartedly. This talk can also be called living life in the fast lane, or life or death in the fast lane. The choice is ours. I believe that no matter what age, no matter what stage of life we're in, we have choices to make that can significantly influence our outcomes, influence our lives, make us live better lives, worse lives, more stressed, more healthy. So the nature of this talk will actually be to go through the various modalities that can be helpful to everybody, no matter what stage of life, but everybody, in order to live a better existence. I'd like to do this as informally as possible. Feel free to ask questions whenever you want. Don't throw any tomatoes, but you can definitely ask questions as long as they're kind. I'd like to start out actually with a little story. And this is a story about a man who's a patient of mine, and I apologize for the fact that he's a man here at the Red Hot Mommas. But he's a man because he was the first patient that I actually took through an integrative strategy for heart disease. And I want to talk about him because he had a tremendous impact on me, and I feel I had a good impact on him as well. And he sort of set the stage for how I now approach heart disease, both for prevention of heart disease and for treatment of heart disease. So here's the story, and this is true. This was several years ago, and this gentleman, who allows me to use his name, so I'll use it. His name is Ray. Ray went to his cardiologist because he had new onset angina. He had chest pain. Whenever he played tennis, he would develop a pressure-like sensation in his chest. He was 60 years old, had high blood pressure for what he said was about 20 or 30 years, was on antihypertensive medications, actually several of them, was on cholesterol-lowering medications, still had a high cholesterol, still had high blood pressure, and now developed angina. He had a stress test. The stress test was abnormal, and I'm sure this is a road that many of you are familiar with, unfortunately. Stress test was abnormal. He was advised to have an angiogram, and he was sent to me for the angiogram. And I reviewed his data, I spoke to him, and in fact I agreed he should have an angiogram. So I took him down to Northridge and did an angiogram down there. And what he had was a 99% blockage in his right coronary artery, a 80% blockage in his circumflex artery, and about a 60% in his left anterior descending. Okay? That's all three of his vessels. All three were blocked. His heart muscle was functioning normally, however. So he had normal heart muscle function. And my knee-jerk response at that time, which is very frequently the response of cardiologists around the country, my knee-jerk response was three-vessel disease, bypass, and in the course of literally 2 minutes, I had a conversation with him lying on the table. You need a bypass? Okay, thank you very much, and I left the room. And I had been reading a lot about integrative strategies, the use of exercise, stress reduction, vitamins, nutrients, supplements. I had been reading about all this different stuff and was starting to integrate it very gently in my practice, but not really fully at that point. And I thought for a moment about, actually for more than a moment, I thought for a long time about this guy because he actually fit into a category where it was not clear that bypassing him would prolong his life. It was clear that bypassing him versus a medical management, that bypassing him would decrease his angina, but it was not necessarily true that bypassing him was going to make him live longer, have fewer heart attacks, have fewer hospitalizations. And that I know because I know the literature regarding coronary disease, because all cardiologists know this literature. And it's based on a number of very good studies that were done in the late 1970s, and it shows that this gentleman could do equally well with bypass or medical management. So why is it that we then tend to say bypass this patient? Well, because I think in our heart of hearts,